Will your next doctor be human or a machine? Artificial intelligence is moving into medicine at a pace we've never seen before. Every week, it feels like a new headline arrives about an algorithm that outperforms specialists, a robot that completes surgery, or a system that makes predictions no human could ever calculate. But what does that mean for the future of medicine? Could we really see a world where doctors are replaced by artificial intelligence? Or will AI simply become another tool, a new generation of stethoscope or MRI that amplifies human skill rather than erasing it? Right now, AI is already outperforming humans in certain narrow tasks. It can read X-rays and CT scans faster. It can detect tiny abnormalities in mammograms that even experienced radiologists miss. It never gets tired, never distracted, never burned out. And in the operating room, robotic-assisted surgeries powered by AI are allowing for precision cuts and delicate maneuvers, with recovery times that are shorter than traditional procedures. At Stanford University, researchers built an AI system that could detect pneumonia on chest X-rays more accurately than a panel of human experts. Google Health created an algorithm for breast cancer screening, and in large trials, it reduced both false positives and false negatives. That means fewer women receiving terrifying diagnoses that turn out to be wrong, and fewer cancers slipping through the cracks undetected. And this is only the beginning. AI is being trained to analyze blood samples, to spot biomarkers that hint at disease years before symptoms appear. It is examining retinal scans to detect dementia, diabetic eye damage, and cardiovascular risks. It is looking at genetic data to identify rare inherited disorders. The reach of AI isn't limited to one specialty. It's spreading across nearly every corner of medicine. Imagine walking into your doctor's office in 10 years. Before you even meet the physician, your medical history has already been scanned and analyzed by AI. Your risk factors flagged, your vital signs compared against millions of anonymized cases. By the time the doctor greets you, an AI-generated report is already suggesting possible conditions, ranked by probability, with recommended diagnostic tests. For the patient, that could mean earlier detection, fewer misdiagnoses, and better outcomes. A cancer caught in stage 1 is often treatable. The same cancer discovered in stage 4 is often terminal. AI has the potential to make those early-stage diagnoses more common, and in many cases, life-saving. But here's the critical question. Does this mean doctors are going to vanish? Will the human physician be replaced entirely? The short answer is no. At least, not yet. Because medicine isn't just data and scans. It's empathy. It's judgment. It's the ability to sit with a frightened patient and explain what's happening in terms they can understand. It's the human touch of placing a hand on someone's shoulder, delivering not just information, but compassion. AI is powerful, but it doesn't comfort a mother when she learns her child has leukemia. It doesn't weigh cultural values or personal preferences when choosing between aggressive treatment and palliative care. It doesn't consider the context of a patient's life. Doctors do. That's why most experts believe the future is collaboration, not replacement. They call it augmented intelligence. AI plus doctors. Machines handling the raw computation. Humans providing the interpretation, the ethics, the empathy. And yet, the question lingers. What happens as AI becomes more accurate than doctors? When patients realize the algorithm might actually be right more often than the physician across the table? Would you want your diagnosis delivered by a human if you knew the machine had a higher chance of being correct? This leads us into the realm of trust. Patients trust doctors not just because of their knowledge, but because of their humanity. When you're scared, you want to look someone in the eye. You want reassurance that you're not just a number on a screen. AI can deliver accuracy, but can it deliver trust? And then, there's liability. If an AI system misdiagnoses a patient, who is responsible? Is it the doctor who relied on it, the hospital that deployed it, or the software company that built it? Right now, there are no clear legal answers. Courts and lawmakers are only beginning to wrestle with these questions. There's also the issue of bias. AI is only as good as the data it's trained on. If that data skews heavily towards certain populations, the algorithm might underperform on others. That could mean misdiagnoses for minority groups, or missed conditions that weren't represented in the training data. Bias in AI medicine isn't hypothetical. It has already been observed, and solving it requires enormous amounts of diverse, high-quality data. Now, let's look further ahead. By 2030, many experts predict AI will be involved in over half of all medical decisions. That doesn't mean it's taking over. It means it's becoming an integral part of the process, like blood tests, like imaging, like lab work. But fast forward further, and the line gets blurrier. What happens when patients start preferring AI doctors? Imagine an AI that can diagnose instantly with a 99% accuracy rate, available 24/7, never rushed, never judgmental. Wouldn't many patients rather talk to that system than wait 3 weeks for a 10-minute appointment with a stressed-out human doctor? And what about cost? AI consultations could be cheap, maybe even free. In countries with healthcare shortages or long wait times, that could be revolutionary. Still, even if AI becomes flawless, there are risks. Patients might start relying entirely on machines. The human bond of medicine could be lost. Doctors could become technicians, merely approving or rejecting the AI's recommendations. Medicine could shift from a deeply human practice to a machine-driven process with doctors as supervisors. Would that be progress or a loss of something essential? Another challenge is education. Medical schools will need to train future doctors not just in anatomy and pharmacology, but in data science and in how to work with algorithms as partners. Doctors may spend less time memorizing and more time learning how to question and interpret AI outputs. In many ways, the doctor of the future might need to be part scientist, part ethicist, part communicator. There's also the global divide to consider. In wealthy nations, AI may act as a co-pilot for skilled doctors. But in poorer countries, AI could be the doctor. A smartphone app diagnosing disease may be the only medical consultation some people ever receive. That raises both opportunity and risk. For now, the balance seems clear. AI is not here to replace doctors outright. It is here to amplify them, to give them tools that see more, detect earlier, and predict better. The stethoscope of the digital age. But the pace of change is accelerating. And with it, the questions get sharper. Would you accept a diagnosis from an AI? Would you let it decide your treatment plan? Would you trust it with life or death surgery? These aren't science fiction questions. They are being debated in hospitals, universities, and government offices right now. The future of medicine is not decades away. It's unfolding in front of us, step by step, breakthrough by breakthrough, case by case. So what do you think? Would you trust an AI doctor, or should medicine always remain human at its core? Drop your answer in the comments, and don't forget to subscribe, to AI Unlocked, where we explore the breakthroughs, the risks, and the future of artificial intelligence. Because the future isn't coming, it's already here.